Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and Little Rock Public Radio.
Hello again, everyone, and thanks very much for being with us. It is that time of year, after all, those months when doctors see their waiting rooms fill up and teachers see classroom attendance go way down. Indeed, that's the case in Arkansas right now, and in a moment we will have an update on the flu situation from a medical pro. First, we are about a month away from the first round of voting in Arkansas. Much, but not all the action is on the Republican side. There's an intra-party challenge to a veteran congressman and to a sitting GOP state senator. On the Democratic side, almost a dozen primaries for the House of Representatives. And let's not leave out the judicial races, which are nonpartisan, kind of. And at the presidential level, the suspense is fairly bearable. Who better now to hash it out but the leaders of the two major parties in Arkansas, Democratic Chair Grant Tennille and his Republican counterpart, Joseph Wood. Mr. Chairman, Chairman Wood, well, both of you, thanks for coming in. Absolutely. Chairman Wood, we'll start with you. What kind of landscape do you see? Is it just red everywhere, or do you feel some blue nibbling at your heels?
Well, I definitely think that the red is here and the red is going to stay. I think we're going to have a very good primary, but really get the eyes looking forward to November, where we'll see even more, not just here in Arkansas, but across the country. With movement and keeping the House and even garnering the Senate and presidency. So,
yeah, in the primaries that I'm looking at anyway on your side, the question seems to be how far right should the party go? Would you quarrel with that?
No, there's the Republican Party does have a very diverse group of folks, obviously, and whether it be the social conservatives or the fiscal conservatives, and so there's always going to be some movement in there. A lot of individual responsibility, a lot of individual thought processes, and that which makes the Republican Party so unique. So yes, there's always going to be a jockeying. The primary will be what the primary is. It's going to bring people out, and we will support the best person who ends up coming out of that to go ahead and move toward the November general election. But yes, it's going to be a lot of dynamics, and not just here in Arkansas, but across the country in that regard.
Okay, but in the primaries that I'm looking at so far, the question seems to be on the part of the challengers is that the incumbent isn't conservative enough.
And that may be their thought process. Again, I don't know if that's the rationale why they got in to run.
Yeah,
but
whether
clearly,
it's cultural or fiscal, that's
correct. And I think that is their charge. Am I getting in to move the agenda, whether it be fiscal or social or what have you, further to whatever that regard is? So again, that becomes the individual, why they're running, what is their thought process. But do we all line up and say, yes, we believe in these principles of the party? Now, how far is what the candidate has to own and run on?
Yeah, Grant Tennille from the Democratic side.
Well, we filed more candidates this time than we filed in a decade. And so I think what you're seeing is a renewed interest in the Democratic Party. I think you're seeing renewed strength within the Democratic Party. And I think that what that will bring you occasionally, and we're not looking at these as a bad thing in most cases, it's important that we have primary contests so that the party can continue to define who we are and what we're for.
Well, in the success that you have had in recruiting candidates anyway,
sure,
was there a common denominator? If there is this renewed interest in the Democratic Party, what is fueling it?
Well, I've said it a few times, but right now there is a whole lot of anger among Democrats and others in Arkansas about the way things are going under this governor. And we said the day filing closed that she was our best friend. Now, I recognize that I'm her best friend too. She raises money on my back. So it works both ways.
What about the presidential level, though? To what extent is our national politics? Let's go to Mr. Wood first, Chairman Wood. To what extent are national politics driving Arkansas politics now?
Well, I think...
is it absolute, or is it...
Well, it definitely has an impact, and I think the chair mentioned the anger if you will, by the Democrats, which is engaging and bringing them out. I think that's the exact same thing that Republicans are saying. We've had, obviously, 4 years under the President Biden's administration, and if we don't look and see what is happening across our country, what's happening across our world with some of the engagement in wars, what's going on across our border, it has really caused Republicans to say, oh, this has got to stop, and we have to engage and get back to some sense of running law and order in this particular country. And so that has engaged and brought a lot of, so the influence from national is truly impacting Arkansas. And so you saw our governor down at the border supporting Texas and their governor, along with, I don't know, the 20 plus different governors saying, we are responsible, the governor is responsible for the people in this state, and yet we're having trafficking, human sex trafficking, fentanyl, all coming through the different parts of the border. That is part of it, and again, that's the anger that I think we're seeing.
And Steve, I think, and we've seen coverage for days now. Some Republicans negotiated in good faith on a solution to the problems at the border. And yes, there are problems at the border. And people of good faith came together to try and find solutions. And they put forward a bill that answered every single thing that the Republican caucus has been saying for years we need. They won't support that bill because they want to run on it. We're taking the safety of Americans and gambling it on the November election.
If the safety was, they would have been addressing this way before now. And I think the biggest one is, if you're putting an example, a cap of 5,000 people coming in a day, when you have had millions, there should be nobody coming in until we get this squared away. And to say, yes, let's go ahead and let 5,000 continue to come a day, that's just continue to bleed what we already are bleeding now. Look at what happens in New York City, Detroit, Chicago. Democrats are furious. So you talk about anger, you're exactly right. And it's all about the national security of our country.
And did the collapse of the deal, though, Chairman Wood, did the collapse of the deal on the House side anyway, did your party, in fact, in the House, hand the Democrats a bargaining chip, hand them a campaign issue?
Well, the House was not supportive of what the Senate was coming out with, because the opening of the border was still there. It was not shutting down and addressing what is on. If you're going to continue to allow people to come in, you have not addressed the issue. The issue is the trafficking, et cetera. So yes, did they give them?
The border of the United States has never been 100% completely closed in the history of the country. It's not possible. 5,000 is a minuscule number.
Wow.
And no, because let's talk about the people who want to come from France and England and Germany and all the people who need to come in here to work. And if we're going to take it to zero, none of those people, the people who repair the machines at Big River Steel, aren't going to be able to move here to do that job?
Well, Chairman Tennille, they are coming under slightly different circumstances.
That's
you
correct.
Would concede, I think, right?
But no, he just said zero.
Until I said
coming in.
We need to stop it until we can figure out what is this quote unquote reform is going to look like. How are we going to address the issues that's coming in?
I'm not wrong.
Yes, I did say it. I did say yes. How are you going to put a bill to say yes, let 5,000 continue to come in when we already 10 million plus are already in this country and we have no idea where they are.
Plus what?
Illegal immigrants have come aboard, and we don't know if that number is true. Many of them, we don't know where they are. We can't address any of the issues if we continue to just allow people to come in without. You can't go to any country without having your shots taken, without going and having some sense of who you are, where you're going, how long you're going to stay, and then when you're coming back.
Mr. Chairman, just because I want to make sure I'm clear.
Last
because
word on that.
Steve asked me. Grant, but you're saying no. You want it shut down. Zero immigration from anywhere into the United States for some period of time that you have yet to determine.
Okay.
Is that true?
I said that the southern borders need to be shut down until we have some real reform put in place. We know who's coming in. We talk about a wall. Yes, Mr. Steve, you opened up with the health issues. You got doctors who are Democrats who are saying, you know what, we probably do need to have people coming through a door, coming in legally so we know who these people are, where they're going, so they're not bringing in diseases, and we have no idea where they're going, and now you have...
And that bill just put all of those things in place.
Let me bring it back to Arkansas.
It did not.
Let me bring it back to Arkansas if I can. One of your announced goals, anyway, on the Democratic side, anyway, was to break the Mr. Wood's party has commanding majorities, of course, in both chambers.
That's correct.
Your goal was one of your goals, anyway, was to break the supermajority in the House, certainly.
And it has to continue to be until we do it, however long that takes.
Do you have a reasonable shot at that with these candidates?
Yes. I believe that there are enough races to break the supermajority in the House, which will essentially get the job done.
Mr. Wood?
I think the majorities will stay as is. In fact, we may even see some increase. So no, I don't see the supermajorities being broke in this election. Yeah, especially what we just got through talking about, the overture of what's going on nationally. Absolutely not.
Okay. Right.
Well, I think that you have parents all over this state incredibly concerned about the state of education and public education.
In what aspect?
Well, just to not get too far into the deep end right away, the governor was asked a few weeks ago whether she knows what the third year of LEARNS is going to cost. She said she does not. That's a little disconcerting because she's going to have to tell us what it's going to cost at the end of the fiscal session in just a couple of months. So if she doesn't know now, we better get to work. But there is legitimate fear that if it's too expensive, that what LEARNS will wind up being is like a $2,500 a month or $2,500 a year voucher program that will do nothing but help people who are already in private school afford it a little easier.
Is that an issue?
There's clearly people who have questions and concerns that are being addressed. And since the passing of that legislation, again, you got a 3-year before it's all implemented. And the charge is, can we walk through and get through? Can we address the questions that people have? Can we work with those schools, those superintendents, those parents who are raising those questions? And they have been, and we have been really addressing those. The larger piece is this. There was 137 years where we were working under a certain, and now we shifted and moved this. We're not asking for 137 years to roll out education and see how it manages. We're saying, give us some time to roll out and implement and phase it in, address the questions as people are asking.
On January 10th of 2013, Education Week Quality Counts report placed Arkansas's public education system in the top 5 nationally. Just to give some credit to the other side, in the same time period, the American Legislative Exchange Council, which is the Republicans' team, placed Arkansas in the top 20. So it hasn't been 193 years of terrible education. In fact, we were in the top 5 in 2013. And a whole lot of that had to do with the work of 2 governors. One of them's name was Mike Huckabee, and the other one's name was Mike Beebe.
All right. You get the last word on that, Mr. Chairman.
I think we're in good place, in good state with our education. We're also addressing our criminal justice. And again, when we start looking at what's going on across this country, people are saying, yes, parents have a right to be empowered and know what's going on in their schools with their students and what's going to be taught to their kids and what's going to be taught to their students. So I think the governor and the legislators took the right move in getting this legislation and LEARNS. And we'll continue to roll through that and address the issues that people are having.
All the congressional, at the congressional level, if we can. The gentleman who sits for Northwest Arkansas, well, for the 3rd Congressional District, he's got a primary. Do you want to venture tell us what the dynamics are?
Oh, you got a long-term senator, Congressman Steve Womack, and again, his challengers, when our sitting senators, Penzo. I think, again, the primary is going to yield out, again, what the voters in that 3rd district wants. Again, it's causing both to up their game and address questions and issues, et cetera. It's going to be a good piece. And again, the Republicans will get behind that candidate when it's all said and done at the end of the primary.
Can you crack all 4 of our delegates, House delegates anyway, are of course Republican. Can you crack that?
I don't think realistically that all 4 of them can be cracked in this year. I am proud of our candidates. I think we've got some strong folks who are in it for more than one cycle. I think they know that this cycle is all about starting a conversation with their constituents and really beginning to dig into what needs to happen. The one thing, if I can, that I'd like to jump into, because the chairman mentioned it, is Public Safety and Corrections, because he said we've addressed that.
We're addressing.
Oh
yes.
yeah, you
That's
are.
right.
It has been absolute chaos for weeks over there, and we're hiring people who've had sex with children and then asking them to resign, and then we're having folks show up and say they're going to run the thing, and then they resign after a couple of days. It's a mess. And it's a mess for a number of reasons. First and foremost, nobody wants to listen to the experts.
Well, we had the expert, and that was Secretary Joe Porfiry, who was in, and again, the legislators brought down and said, this is where we're going to be heading. Porfiry had the plan of where we're going to go. They moved toward that direction, except the board said, no, we don't. And so they took that, in my mind, away from the governor, who appointed and brought him in to run this particular operation. And they said, no, that's our responsibility. And now the legislators will have that as their opportunity to say, why do we have boards without any?
It's actually not a legislative issue.
That's enough.
Well, from a constitution, it would be. That's correct.
No, but the
That's
legislature doesn't fix the Constitution. The people do.
Well, they can take an amendment and have that and draw that in for themselves.
I'll give you 30 seconds each now on the judicial outlook. Some of the candidates make, Mr. Chairman, very little, or if any, effort at separating themselves from their Republican roots. Are you uncomfortable with that? You would not be uncomfortable with that, I assume.
No, I don't. I do think people are who they are, and I know at one point you did have to decide what side of the fence you were on. Now we don't, but I think at the end, when you can look at their record and their docket to see how they rule, you can kind of get a sense of their leanings. Yes.
Yeah. Grant Tennille.
And again, I think you've always been able to get a sense of the leanings of judges based on their decisions. That's correct. But I think we're beginning to cross over, and it's something that we're resisting as hard as we can in the Democratic Party, because I think that people who have to stand before judges seeking justice have to believe that that judge is impartial. And if the judge has a declared preference for one stripe over another, then it's easy to question their impartiality.
Got to end it there, gentlemen, because we're out of time. When things get settled a little bit after March, we'll have you both back. Thanks for coming in.
Thank you.
And we'll be back in just a moment. And we are back. The flu and other respiratory viruses. Arkansas's case rate is high and getting higher. Schools across the state are reporting high absenteeism, students and teachers, and employers are trying to cope with a workforce that is suddenly smaller owing to a microscopic menace. And COVID, it is still with us. For an assessment of the situation and the outlook, we're joined by Dr. Robert Hopkins, an internal medicine specialist at the University of Arkansas for Medical Sciences. Dr. Hopkins, thanks very much for coming back. Welcome back, by the way.
Thank you, Steve. Happy to be here.
Well, I'm looking at I hope it was under different circumstances, but I'm looking at the statistics from the national clinical organizations. We were, a few days ago, Arkansas high in terms of our case rate. Now we have gone from high to very high. Any surprise on your part?
No, it really isn't, Steve. We're seeing the same thing. I primarily practice in the office, and we're getting lots of calls from people who've got influenza-like illness. Talking to my colleagues that work in the hospital, we've got lots of patients in the hospital with influenza, a fair number with COVID-19, and even a few adults in the hospital with RSV. Although, fortunately, RSV seems to be fading a bit, but COVID and influenza are still running wild.
All right, doctor, are these seasonal viruses that you're encountering now, that the doctors across the state are encountering?
Well, influenza tends to be seasonal, although the timing of onset of that seasonal surge tends to vary a bit from year to year. Last year, we started early, well before Thanksgiving. This year, we started at our more usual time, around Thanksgiving, while much of the country seems to have peaked out a couple of weeks ago and be starting to trickle down. Unfortunately, here in the South, numbers continue to rise.
What's the regional aspect there, Doctor?
Well, it's just interesting that we tend to see influenza rise and fall in different areas at different times. At present, the South seems to have the most increase in influenza disease, although there's also a fair amount of activity in the DC and up to New York area, as well as out to the mountain states.
I'm anticipating you're going to tell me that this is largely an urban situation, or the spike is in the urban areas. The case rate is higher in the urban areas.
We certainly have seen that here in Arkansas and other areas. If you look at the data from our own health department, the rates are higher in central Arkansas than they are across other areas of the state, although it's impacting people across the state of Arkansas.
Are we dealing here with a variety of microbes or viruses here?
We are. The majority of it is influenza and COVID-19, but there's also RSV. We've seen some metapneumovirus, which is a virus we don't have a vaccine for. And I'm sure there are a number of other viruses that are causing some of the outpatient illness. Fortunately, those are less likely to cause people to be sick enough to end up in the hospital.
The demographic spike that I'm seeing here, Doctor, from the data that I've been provided anyway, from the national organizations and from Arkansas, is the 5 to 17-year-old age bracket. We're talking about the K-12 bracket, so to speak.
Well, children are, I don't mean this in a negative way, but children are very effective at transmitting viruses from one to another. And so with schools being open, the kids are crowded in there. They're spending a lot of time in their classrooms. They're doing lots of other indoor activities, particularly with all the rainy weather we've had in the last few weeks. And that contributes to spread among the school-age population. From there, those viruses go home to their families, from the members of their families to others. And we've seen a real drop-off in influenza vaccination rates through the last couple of years. And so you get a combination of low vaccination rates with highly transmissible viruses. We see lots of disease in our communities. Are
you surprised at that slowdown in the vaccination participation?
No, unfortunately, I'm not. I think there's been a lot of hesitancy around the COVID-19 vaccine that has rolled over into a number of other vaccines. I think it's important that we recognize for routine childhood immunization, generally, the vast majority of people continue to vaccinate, as they should. But vaccination rates for influenza and COVID-19 have been far less than they need to be, and that puts a lot of people needlessly at risk, from small children down to 6 months of age on through our older adult population.
Well, do you have a message particularly for parents now, Doctor? What vaccines are available? Is there an information gap here?
Well, I think the two messages I would get out are, first and foremost, if you're sick, please stay home. Take care of yourself. Reach out to your healthcare provider for recommendations for taking care of your symptoms, controlling fever, getting fluids down, and resting. Second is, if you have not had your influenza vaccine or your COVID-19 vaccine, the 23-24 vaccine that we've been using since September, October, please get them. It is not too late. We are at least 6 more weeks in our influenza season. COVID is still running rampant. And I want people to have all the protection from severe disease as well as from infection that they can get.
COVID never went away. I mean, and I'm looking here, if I have the data correctly, Doctor, deaths from COVID in Arkansas last year, or the last reporting period, 12-month reporting period, were far more deaths. I mean, something like 10 times more deaths from COVID than from influenza.
That's right. COVID is a bane on our society still. We know that this winter surge of COVID has been one of the worst surges, and we've had an opportunity to reduce that with vaccination, but vaccination rates are horribly low. There is still a tremendous amount of misinformation out there. This COVID-19 vaccine we have available is safe. It is effective. I've given it to all of the members of my family. I've encouraged all the members of my team and every patient that I see, as well as every opportunity like this, to encourage people to get that vaccine. Our flu vaccine, similarly, is safe. It is most effective at reducing severe disease. It doesn't prevent everyone from getting infected, but if we can reduce the likelihood of you getting sick enough to end up in the hospital, we reduce the likelihood of deaths. And we need to do everything we can to try to keep our society healthy. And Flu and COVID-19 both, we see the most hospitalization, the most severe disease in our older adult population, but we also see both of these diseases in healthy adults, in healthy children, even down to healthy small children. Kids under 2 years of age in particular are at very high risk for severe flu and COVID-19.
Who is eligible, in terms of the age demographic, doctor, who needs to be in, at what age is it appropriate for immunization to begin?
Immunization for influenza and COVID-19 should start at 6 months of age.
6 months?
Yes, 6 months.
Got it. Dr. Hopkins, as always, thanks for coming in, and come back again soon. I hope under nicer circumstances than influenza.
Absolutely. And everyone wash your hands and stay away from sick people.
All right, good. Doctor, thanks very much for being with us. That does it for us for this week. As always, thanks for watching, and we'll see you next week.
Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and Little Rock Public Radio.